My name is Randy Bigley. Joining me right now from Legacy in Bucyrus, I have Erica and Brandon. Good morning.
Good morning.
Good morning. How's things going out there at Legacy?
Good, staying busy.
Good. What all is happening out there?
We have a new medical director. Dr. Stormont out of Gallion is overseeing the facility now as our medical director. Dr. Harris still rounds and still sees patients there as well. And we relocated some beds, so now our memory care unit can hold a max of 18 residents.
Wow.
Yeah. And our skilled hall now has 2 private rooms that we are able to offer.
Okay, well that's new then, isn't it? Yeah.
Yes.
Yeah, very cool. You guys just keep improving out there, don't you?
Little by little.
Yeah. So what all is available out there at Legacy? If someone has heard the term maybe Legacy out there, what kind of services are available out there?
We offer short-term skilled care. We offer long-term care where people reside there, they live there as their homes. Memory care, we offer in-house physical therapy, occupational therapy, and speech therapy. We have a wound provider that comes in and rounds weekly. And we are able to offer some behavioral health services as well.
I know the memory care you added not too long ago. I mean, it hasn't even been a year yet, has it? Almost a year already?
Yeah.
Wow. So I remember I came out to your open house for
Yes.
that. That's been almost a year already?
It has.
Wow, I can't believe that. But what a beautiful facility out there. And like I said, there's lots of services you guys provide out there. And it's a really, really nice place. If you're interested, I'd check it out. I mean, if you haven't ever checked it out, can people come in and get a tour?
Absolutely. Anytime.
How do they do that?
They're welcome to stop by and request a tour, or they can contact us and get one scheduled, and one of the department heads will be happy to show them around.
Very cool. Brandon, welcome.
Thank you.
What would you like to add today?
Yeah, so I'm the business office manager at our facility,
Yeah.
and I kind of have the weird side of healthcare because being kind of the non-clinical side, and most people just see me at the building as the money guy. But
right.
Essentially, my role there is to first and foremost be able to protect the financial interests of the building and just to make sure that we're profitable. A lot goes into that as far as Medicare, Medicaid, running insurances, things like that. Just making sure that the people that are going to come to our facilities from local hospitals or even the community, that they have proper insurance coverage. I mean, let's face it. Long-term care, it's not cheap by any means,
right.
But there are ways that insurances will pay for people's stay, and sometimes they don't know about it. Oftentimes we have people that have coverage and they have no idea that they even had it.
Right, yeah.
The adoption of the Affordable Care Act, when that started, a lot of people got coverage that they've never had in their entire lives. So they have insurance, but they don't know how to use it. So that's one of the things that we like to do. You kind of mentioned tours. We try to have everybody kind of stop at least and have a little conversation with me just to find out what their insurance situation is like, and if this is a good fit for them. I want to get somebody to pay for it for them.
Sure,
so
right. Yeah.
Really, that's kind of my goal. And then the secondary thing, which is equally as important though, is protecting the financial interests of the actual residents that with us. A lot of them, they have bank accounts that they're not able to access, or they have family members that take care of their funds. And sometimes the world we live in, unfortunately, things don't go the way that the residents would like them to. So it's up to us to kind of advocate for our residents and make sure that they're financially sound as they spend either a short-term or long-term stay with us.
Yeah, and like I said, with Medicaid, Medicare, it'd be kind of complicated too.
Extremely.
Yeah.
I've been with the company now a year, just a few weeks ago, and I still learn something new every single day. It's such a void between what the government does on the financial side of healthcare and then what we're able to do at the facility level. So it's very, very important to stay on top, because the minute you get the regulations down, blink and they change again.
Right.
So really staying informed and knowing kind of what the current regulations and compensations are is, I think, really, really important for facilities in this day and age.
And if you have a question, just ask, right?
Absolutely.
Yeah.
Absolutely. Our advice is free. So
exactly.
we like to give that out as much as we possibly can.
Right.
So we always tell families that when they tour, it's like, hey, if you have any questions to navigate this process, either speak with an attorney if you have one, or call us, because we'll be happy to help you out.
I can imagine it could be a scary thing too. I mean, it's a lot of money,
Absolutely.
Yeah. And so, a lot of these people are going to be there the rest of their lives, right?
It becomes their new home. So we want their home to feel as comfortable as the home that they come to us from. So it's just a matter of you're not going to be comfortable if you're not financially taken care of, and that's a slippery slope for anybody who's dealt with that. So we want our residents to be able to rest easy knowing that we've got their backs, and we like for the families to have the exact same feeling, because we know when they bring the loved one there, they're entrusting us to not only take care of them physically, but mentally, emotionally, and financially. So that's
Right.
really kind of where I come into play.
Very cool. And if someone has any questions, just get a hold of you, right?
Absolutely.
Right. How can they do that?
They can call. They can call in. They can email me. They can reach out to us really any way. I don't have social media, but that would work too.
Yeah,
They can reach out to us any way they have. We'd be happy to connect with them and provide whatever resources we need.
Okay. Erica, where are you located at?
We're located at 1170 West Mansfield Street.
Very cool. Very nice. Like I said, it's a nice place. If you've never checked it out, get out there and check it
Yes.
out.
Please come see us.
All right. Thank you so much for coming in today.
Thank you.
Thank you.
Thank you.